When it comes to restoring hearing, advanced surgical techniques have revolutionized the field of otology. Dr. Evans Kadero at Nairobi ENT Clinic is at the forefront of these innovations. Among the recent advancements in cochlear implantation are changes in electrode design. These new designs aim to better integrate with the cochlea, improving the overall effectiveness of the implant. Additionally, hearing preservation options have become more sophisticated. These options allow for partial hearing to be maintained even after the implant is placed. Advancements in connectivity have also been a significant part of recent developments. These advancements enable better integration with other technologies, such as smartphones and hearing aids. The UC Health Hearing and Balance team, reachable at 513-24755-8400, specializes in such advanced techniques. A study by Soloperto and Confuato published in February 2024 in Audiores highlights the long-term outcomes following cochlear implantation. Their findings show that even with advances in technology, individualized care remains crucial for optimal results. At the Nairobi ENT Clinic, Dr. Kadero and his team are committed to providing such tailored care to each patient. In the broader scope of hearing health, advancements in connectivity and electrode design are just the beginning. As research continues to uncover new methods and tools, the future of hearing restoration looks brighter than ever before. So, when it comes to restoring what is arguably our most vital sense, we can rely on advanced surgical techniques to pave the way for a world where everyone has the chance to hear again. And with pioneers like Dr. Kadero leading the charge, that future may be closer than we think. With his extensive training and innovative approach to patient care, Dr. Kadero is known for transforming lives through cutting-edge procedures that preserve hearing. One of Dr. Kadero's significant contributions is his work with auditory brainstem implants, a complex procedure that offers hope to patients with severe hearing loss. At the Nairobi ENT Clinic, located on the 5th floor of the Anderson Building in Nairobi Hospital, he provides specialized care for conditions affecting both hearing and balance. His achievements extend beyond surgical techniques. He's also made significant strides in understanding and treating dizziness and balance disorders like BPPV and Meniere's disease. Beyond his clinical work, Dr. Kadero is committed to educating future ENT specialists through his involvement in medical training and research programs. His dedication to patient care and innovative spirit make him an expert you can trust to lead the way in hearing restoration. Cochlear implants, devices that bypass the damaged inner ear to transmit sound signals directly to the brain, have undergone significant evolution since their inception. This journey begins with early pioneers like George E. Shambo Jr., who made innovations in treating otosclerosis. Shambo's work laid the groundwork for understanding and addressing hearing loss, paving the way for more advanced surgical techniques to come. In recent years, researchers like Gennaro Conforto have delved into the long-term effects of cochlear implantation, specifically focusing on what is known as device aging. This refers to the long-term changes in hearing performance that can occur after initial implantation. Changes in electrode design represent another significant leap forward. These innovations aim to enhance the performance and durability of cochlear implants, ensuring that patients can enjoy improved hearing over an extended period. However, it's crucial to recognize that while the success rate of cochlear implantation has improved significantly, variability remains based on individual cases. This underscores the importance of specialized care and advanced surgical techniques in achieving optimal outcomes. The advances in cochlear implant technology highlight why today's advanced surgical techniques are so significant. They offer patients the best chance at restored hearing, making a tangible difference in their quality of life. Did you know that the modern ear implant design has undergone significant advancements over the years? Meet Dr. George E. Shambo Jr., an innovator in the field of otolaryngology who played a pivotal role in advancing these designs. But what makes modern implant design so significant? These newer designs are more sophisticated and allow for better preservation of residual hearing, which was not possible with earlier models. Think about it this way. Modern electrodes are like a delicate, custom-made bridge that allows sound signals to pass through while avoiding damage to existing structures in the ear. In addition, surgical techniques have become more precise and less invasive, reducing complications and recovery time for patients. This means that today's advanced implant designs offer patients a higher chance of successful hearing restoration with fewer risks and side effects. Today, we're diving into a remarkable surgical technique that's changing the game for people with profound hearing loss. It's called an auditory brainstem implant, or ABI for short. An ABI is a tiny device placed in the brain to provide a sense of sound for people who can't benefit from traditional cochlear implants. To understand how an ABI works, imagine this. Your brain is like a city with different districts, each responsible for specific functions. The auditory brainstem is one of these districts. It's the command center that processes sound information coming from your ears before sending it to other parts of the brain. In some cases, damage or missing components in this district make traditional cochlear implants ineffective. This is where an ABI steps in. An ABI bypasses the damaged areas and directly stimulates the auditory brainstem, creating a sensation of sound for people with profound hearing loss due to conditions like neurofibromatosis 2, NF2, or a non-functioning cochlear nerve. Places like the Cleveland Clinic and Apollo hospitals are leading the way in providing safe, advanced, and affordable ABI procedures. These experts offer hope to those who thought hearing restoration was out of reach. But let's not forget the incredible advancements in connectivity that are making these implants even more effective. As research continues, we're seeing improvements in sound perception and lip reading abilities for people who once thought their world was silent. Think of it as a tiny, revolutionary device making giant leaps in the world of hearing restoration. And that's what makes an auditory brainstem implant so extraordinary. Imagine the joy and relief when someone who couldn't hear a whisper before can now perceive sounds again, opening up new pathways of communication and connection. That's the power of an ABI. As we move forward, it's exciting to see how these advancements will continue to evolve and improve lives. For those with profound hearing loss, ABIs are offering a lifeline back into the world of sound. One of Dr. Cadero's success stories involves a patient named Joseph, who at 16 years old was diagnosed with neurofibromatosis type 2, NF2, a genetic condition that causes tumours to form on the auditory nerve. Before receiving an ABI, Joseph struggled with profound hearing loss in both ears. Despite trying various hearing aids and other interventions, he found it challenging to communicate and engage with the world around him. Dr. Cadero recommended an ABI for Joseph, explaining that this device could bypass the damaged auditory nerve and stimulate the brainstem directly, providing a sensation of sound. After undergoing the surgical procedure, Joseph was fitted with an ABI processor that transmits sounds to his implant. Within weeks, he began to experience a significant improvement in his hearing ability. Now, Joseph can communicate more effectively with family and friends. He no longer feels isolated and has regained confidence in social situations. The ABI has given him a new lease on life, allowing him to participate fully in his community. Another remarkable case involves a patient named Grace, who suffered sudden hearing loss after an ear infection at the age of 35. Despite aggressive treatments, her hearing did not recover, leaving her with profound deafness in one ear. Grace felt frustrated and disconnected from the world around her. She found it difficult to follow conversations in noisy environments and struggled with her professional life, which required frequent communication with clients and colleagues. With her newfound ability to hear, Grace was able to return to work and reclaim her professional life. She can now communicate effectively with clients and colleagues, restoring her confidence and independence in her daily activities. These success stories highlight the transformative power of ABIs in restoring hearing for individuals with profound hearing loss. Advanced surgical techniques and innovative devices like ABIs are giving patients a chance to reconnect with their world, leading richer, more fulfilling lives. Dr. Cadero stresses that thorough preoperative preparation can optimize post-operative outcomes and reduce potential complications. This phase involves carefully evaluating the patient's medical history, conducting comprehensive hearing assessments, and ensuring that all necessary imaging and tests are performed. One crucial aspect is adjusting to the cochlear implant post-surgery. This process requires time and effort, as patients need to learn how to interpret the new signals their brain receives. Proper preoperative preparation can help ensure that patients are well prepared for this adjustment period, making it smoother and more effective. By understanding each patient's unique needs and medical background, Dr. Cordero can tailor the treatment plan to optimize their chances of success. Studies have shown that patients who undergo thorough preoperative pathways experience better outcomes compared to those who do not receive such careful preparation. These pathways include detailed consultations, hearing assessments, and even counseling sessions to manage expectations and provide emotional support. Dr. Cordero often spends additional time with his patients, explaining the surgery process step by step and answering any questions they may have. This personalized approach helps to put patients at ease and sets a solid foundation for their recovery journey. But why is this human touch so important? Because cochlear implant surgeries are not just about the technical aspect. They're also about helping patients reconnect with their world and regain a vital part of their lives. By ensuring that each patient is well prepared and emotionally supported, Dr. Cordero can significantly enhance the chances of a successful outcome. And in this field, every small improvement counts. The importance of preoperative preparation cannot be overstated. It's not just about the day of surgery, but also about setting the stage for a smooth recovery and a successful integration of the implant into the patient's life. As we've seen, proper preoperative care is the linchpin that ensures advanced surgical techniques and innovative devices like ABIs can truly make a difference in the lives of those with profound hearing loss. So, the next time you think about restoring hearing through surgery, remember that it's not just the operation itself that counts, it's the meticulous planning and care that come before it. In addition to improved connectivity, recent developments also include changes in electrode design. These innovations aim to preserve more residual hearing, opening up new possibilities for those with single-sided deafness or other specific conditions. But the future holds even more promise. Researchers like Dr. Cordero are exploring groundbreaking techniques such as stem cell therapy to regenerate damaged inner ear cells. This cutting-edge approach could potentially restore natural hearing without the need for implants. Moreover, advanced imaging technologies are being refined to provide surgeons with precise 3D maps of the inner ear. This level of detail can significantly enhance surgical accuracy and precision during delicate procedures. The intersection of biotechnology and medicine is also yielding exciting breakthroughs. Scientists are developing gene therapies aimed at correcting genetic defects that cause hearing loss. These therapies could be a game changer for those with inherited conditions. While these innovations are still in the experimental stages, they hold tremendous potential to reshape the landscape of hearing restoration. Imagine a world where hearing loss can be treated not just with devices but also through targeted biological interventions. Dr. Cordero and his colleagues are optimistic about the future of their field. They look forward to the day when these advanced techniques will become standard practice, offering hope and improved quality of life to countless patients suffering from hearing loss. As we continue to advance, it's important to recognize the profound impact these innovations will have on people's lives. Each breakthrough brings us one step closer to a world where hearing loss is no longer a debilitating condition, but something that can be effectively managed and even reversed. And with each new discovery, we inch closer to a future where hearing loss is no longer a barrier, but an opportunity for transformation and improvement in people's lives. Here, advanced surgical techniques are not just a luxury, but a necessity. According to the World Health Organization, WHO, at least 700 million people worldwide could benefit from hearing aids and other assistive technologies. Imagine the global impact if every person who needed hearing assistance could access it. It's not just about restoring sound. It's about reconnecting people to their communities and lives. Advancements in cochlear implantation and hearing preservation techniques are making this possible. Studies like those published by Soloperto and Conforto reveal the long-term benefits and outcomes of these procedures. Understanding these advancements underscores the broader implications of such technology on a global scale. It's not just about restoring sound, but about transforming lives and connecting communities. At the heart of Dr. Cordero's approach lies an auditory brainstem implant, a surgical procedure that bypasses the inner ear and directly stimulates the auditory nerve. This cutting-edge technique allows patients with profound hearing loss to experience sound again, transforming their lives in ways previously unimaginable. Dr. Cordero's patients play a crucial role in driving further innovations. Their feedback and experiences shape the future of these advanced surgical techniques. These advancements are not merely technological achievements, but tangible improvements in the quality of life for those who benefit from them. Moreover, connectivity advancements in cochlear implantation enable patients to interact with their devices more seamlessly than ever before. As Dr. Cordero emphasizes, patient-centered care is not just about the procedure itself, but also about the journey of recovery and adaptation post-surgery. Preoperative preparation and patient pathways play a significant role in optimizing these outcomes, ensuring that each patient's unique needs are met from start to finish. The future of advanced hearing restoration techniques is bright, driven by the invaluable insights and experiences of patients like those cared for by Dr. Cordero. Ultimately, it's the patients who are shaping the course of these innovations, highlighting the indispensable role of patient-centered care in advancing hearing restoration. By placing their experiences at the forefront, we ensure that these technological marvels continue to transform lives and connect communities for generations to come. Meet Davide Soloperto, an expert in cochlear implant research from the University Hospital of Modena. Soloperto's work focuses on understanding the long-term effects of these advanced surgical techniques, aiming to transform how we approach hearing restoration. One of his key contributions is a study conducted in collaboration with Gennaro Conforto from Sassuolo Hospital, exploring how these devices age over time. This groundbreaking research reveals that while cochlear implants are remarkably effective, their performance can be affected by what is termed device aging. Think of it like a fine instrument that needs regular tuning to maintain its brilliance over decades of use. Soloperto's vision for the future involves continuous research and technological advancements that could potentially eliminate the concept of device aging. Imagine a world where cochlear implants not only restore hearing but also adapt and improve with age, providing lifelong benefits to millions. This expert's vision of a future without hearing loss is not just a dream, it's a testament to the power of ongoing research and the potential to transform lives globally. With every advancement, we move closer to creating a world where hearing loss is minimized and every individual has the opportunity to hear the symphony of life around them. In the realm of restoring hearing, one of the most significant advancements is the Auditory Brainstem Implant, or ABI. Unlike traditional hearing aids that amplify sounds through the ear canal, an ABI bypasses the inner ear entirely and directly stimulates the auditory nerve. Recent research has focused on upgrading ABIs to improve their functionality and outcomes. One major advancement is in signal processing, where new algorithms are being developed to enhance the clarity of the sounds transmitted by ABIs. New surgical methods are also being explored to ensure better placement and integration of the implant in the brainstem, which can lead to more stable and effective outcomes. As we continue to innovate and refine these technologies, the promise of restoring hearing through advanced surgical techniques grows ever brighter. Through each advancement, we take a step closer to creating a world where the joy of sound is accessible to all. And in the hands of skilled experts like Dr. Cordero, the future of hearing restoration looks very promising indeed. Changes in electrode design aim to improve the way sound signals are transmitted and perceived by the brain. These advancements can enhance speech recognition and overall hearing experience for patients. Beyond hardware, advances in sound processing strategies have also made a significant impact. New algorithms are designed to mimic the natural processing capabilities of the human ear. These innovations can provide clearer and more realistic sound reproduction, making it easier for patients to adapt to their cochlear implants. Additionally, developments in implant design focus on improving biocompatibility and reducing surgical trauma. With these advancements, experts like Dr. Cadero can offer more personalized recommendations for their patients, leading to better outcomes and a higher quality of life. The continuous evolution in cochlear implant technology is driven by the relentless pursuit of improving patient experiences. And as these innovations continue to unfold, the horizon for hearing restoration looks increasingly promising. One such advancement is the use of artificial intelligence, AI, in hearing restoration surgeries. AI has revolutionized preoperative planning by analyzing complex medical data to create personalized surgical strategies. These AI tools can predict the best course of action based on the patient's unique health profile, reducing risks and improving outcomes. Intraoperative guidance systems powered by AI assist surgeons in real time, providing crucial information during delicate procedures. But the application of AI doesn't stop at the operating table. Post-operative patient monitoring has also been transformed by this technology. Advanced algorithms can track a patient's recovery in real time, alerting healthcare providers to any potential issues. Dr. Cadero's work is not just about restoring hearing, it's about improving lives. His use of advanced technology underscores a commitment to delivering the best possible care to his patients. As we delve deeper into this innovative world of AI-assisted surgeries, it becomes clear that the future of hearing restoration looks increasingly promising. At UC Health, the Hearing and Balance team takes a meticulous approach to patient selection for advanced surgical techniques like auditory brainstem implants, ABIs. The process begins with a comprehensive assessment of the patient's medical history and current health status, ensuring that they are fit for such an advanced procedure. In addition to physical health, audiological factors play a significant role in determining the suitability of a patient for these techniques. Residual hearing levels and the degree of hearing loss are crucial considerations. The presence of residual hearing is particularly important as it can affect the success of cochlear implants, which rely on stimulating the auditory nerve directly. Psychological factors are also taken into account to ensure that patients can cope with the emotional and mental changes that come with such a significant procedure. The team at UC Health believes in a patient-centered approach, involving the individual throughout the decision-making process to ensure that their unique needs and circumstances are fully considered. Patient selection is not just about technical suitability, but also about ensuring that patients can adapt to the new sensory experiences provided by these advanced techniques. By taking a holistic view of patient selection, experts at UC Health aim to ensure that those who undergo these procedures achieve the best possible outcomes. This comprehensive approach provides a thorough understanding of which patients are best suited for these advanced surgical techniques, guiding experts in their crucial decisions to ensure optimal results. Robotic systems like the Da Vinci surgical system provide high-definition 3D vision and enhanced dexterity, making even the most challenging ear surgeries possible. Clinical trials have shown that robotic-assisted surgeries reduce complications and improve patient outcomes. This isn't just about technology. It's about giving patients the best chance at regaining their hearing. But how does this technology work in practice? Imagine a delicate procedure to implant an auditory brainstem implant. The robotic arms can maneuver with micrometer precision, navigating the brain's tiny structures without causing any collateral damage. This level of control isn't just innovative, it's life-changing for patients who once faced severe hearing loss or damage to their auditory nerves. And the benefits extend beyond just accuracy. Robotic systems can also enhance safety for both patients and surgeons by reducing exposure to radiation during procedures that require imaging. As Dr. Cadero puts it, the future of hearing restoration lies in the intersection of technology and medicine. His work is a testament to this vision. So, the next time you wonder about the cutting edge of medical technology, remember that advanced surgical robotics are not just a thing of the future, they're here now, making miracles happen for patients like you. And with every advancement, we move closer to a world where hearing loss is no longer a barrier, but just another challenge conquered by human ingenuity. One of the most promising areas of research involves stem cells and their potential to repair inner ear damage. These cells have the remarkable ability to regenerate tissue, offering hope for those with severe hearing loss. Studies have shown that stem cells can differentiate into the various types of cells found in the inner ear. This capability is particularly significant because the inner ear is a complex structure that plays a critical role in both hearing and balance. While advances in cochlear implantation have significantly improved hearing outcomes for many, there are still limitations to this technology. For those with profound hearing loss, particularly in the inner ear, regenerative medicine offers a potential solution that could be truly transformative. Gene therapy is another avenue being explored to address hearing loss. By targeting specific genes involved in inner ear function, researchers hope to correct genetic defects that can lead to deafness. These gene editing techniques could potentially restore hearing in individuals with inherited forms of hearing loss. Although the field is still in its early stages, the progress being made is incredibly encouraging. Their commitment to staying at the forefront of medical innovation ensures that those with hearing loss have access to the best possible care. With every advancement in regenerative medicine, hope grows for those who have longed to hear the world around them once again. Meet Dr. Cordero, an ENT surgeon who's been at the forefront of using advanced imaging techniques to restore hearing through intricate surgical procedures. Advanced imaging, such as high-resolution MRI and CT scans, is playing a crucial role in preoperative planning by providing detailed visuals of the inner ear structures. Functional neuroimaging, which maps brain activity, is enhancing intraoperative navigation by guiding surgeons through delicate operations with precision. These imaging technologies allow for precise targeting of the auditory nerves and cochlear implants, ensuring minimal tissue damage and maximum hearing restoration. Moreover, 3D imaging is being used to create virtual models of the inner ear, enabling surgeons to practice complex surgeries before they even step into the operating room. With these advanced tools, Dr. Cordero and his team can plan each surgery meticulously, adapting to the unique anatomy of every patient for optimal results. The journey towards a successful hearing restoration surgery begins with accurate preoperative imaging, setting the stage for precise surgical interventions. And when it comes to intraoperative navigation, advanced imaging guides every delicate move, ensuring that each step is as precise and successful as the last. This level of precision and planning is what sets apart pioneering surgeons like Dr. Cordero, who are at the helm of restoring hearing through advanced surgical techniques. The OSSO platform, for instance, allows surgeons to practice delicate procedures such as cochlear implantation with the precision required to minimize damage to surrounding tissues. This not only enhances their manual dexterity, but also helps them familiarize themselves with the anatomy in a way that is not possible through traditional textbook learning. In addition to individual training, VR also facilitates collaborative learning experiences. Medical teams can practice together in a virtual environment, simulating different scenarios and refining their communication and teamwork skills. This level of preparation ensures that when they step into the real operating room, every member of the team is well coordinated and ready to handle any situation. Research has shown that surgeons who have trained with VR are more confident and perform procedures more efficiently, leading to better patient care. By allowing for repeated practice in a risk-free environment, virtual reality is enhancing the quality of surgical education and ultimately benefiting those in need of advanced hearing restoration techniques. As virtual reality continues to evolve, it promises to unlock new possibilities in medical training. Surgeons like Dr. Cordero can expect to see even more sophisticated simulations that will further enhance their skills and contribute to the ongoing advancement in hearing restoration techniques. The future of surgical training is being shaped by such innovative tools, ensuring that patients receive the best possible care. With virtual reality leading the way, the field of hearing restoration is poised for significant breakthroughs, making a tangible difference in the lives of those with hearing impairments. Ultimately, the integration of virtual reality into medical education demonstrates how advanced technologies are enhancing surgical training and ultimately improving patient care in hearing restoration. As we delve deeper into the world of virtual reality, one thing is clear: the future of medical training is here, and it is promising a new era of precision and excellence in the field of hearing restoration. In the cutting edge of medicine, we're witnessing remarkable advancements in hearing restoration through gene therapy. These breakthroughs offer hope to millions suffering from profound hearing loss. Let's delve into this pioneering field and meet the experts who are at the forefront of these innovative techniques. Gene editing techniques, such as CRISPR-Cas9, hold promise for correcting genetic mutations that cause hearing loss. By precisely targeting and repairing faulty genes, scientists aim to reverse the damage. In advanced cases where traditional treatments fail, gene therapy offers a glimmer of hope. Imagine being able to regain hearing through a simple injection, bypassing the need for invasive surgery. But this is not just about restoring hearing. Gene therapy could revolutionize our understanding of genetic disorders and open new avenues for treatment. The potential benefits are immense. Not only could individuals regain their hearing, but they might also experience improved quality of life, reduced social isolation, and enhanced cognitive function. However, as with any new technology, there are challenges to overcome. Ensuring the safety and efficacy of these treatments is a priority for researchers like those at UC Health. With continued advancements in gene editing and ongoing clinical trials, the future of hearing restoration looks brighter than ever. These pioneering efforts are paving the way for a new era of precision medicine. So, let's stay tuned to these groundbreaking developments as they unfold and embrace the promise of a world where hearing loss is no longer a barrier. This chapter has given us insights into the exciting potential of gene therapy for hearing restoration. As we move forward, let's keep our eyes on the horizon where these innovative solutions are leading us. One of the key advancements in this field is the development of adaptive technology that tailors sound processing to individual patient needs. By integrating personal data and real-time feedback, these algorithms can provide a highly customized listening experience. These personalized algorithms take into account factors such as residual hearing and single-sided deafness, ensuring that the cochlear implant delivers the most effective sound processing for each individual. Moreover, advancements in connectivity have made it possible to continuously update and refine these algorithms based on ongoing data from the patient's everyday life. Imagine a cochlear implant that can learn from its user over time. With each interaction, the device becomes smarter and more attuned to the specific sounds and environments that matter most to the individual. This level of personalization is not just about technical innovation, it's about restoring a sense of normalcy and confidence in daily life. The integration of patient data into these custom algorithms is a testament to the power of modern medicine in creating solutions that truly understand and respond to our unique needs. As we delve further into this pioneering work, it's clear that the future of hearing restoration is not one size fits all. Instead, it's a tailored journey where each person can regain their sense of sound in a way that perfectly fits their life. In conclusion, the remarkable advancements in customized sound processing algorithms are not just about technology, they're about giving people like you and me a chance to hear the world in our own unique way. As we look ahead, these personalized solutions promise to significantly enhance hearing outcomes and transform lives, making every sound count. Scientists are exploring new materials and configurations to enhance the performance and safety of these crucial components. One major innovation is the use of flexible, biocompatible materials that reduce tissue damage and improve patient comfort. These advanced materials allow for more precise stimulation of the auditory nerve, leading to better sound quality for the user. Another significant development is the introduction of novel array configurations such as perimodiolar and extended arrays. These new designs can target specific regions of the cochlea more effectively, optimizing hearing restoration in patients with varying degrees of deafness. researchers at institutions like the University Hospital of Modena and Sassuolo Hospital are leading studies on these innovative electrode arrays. Their work aims to understand the long-term effects of these new technologies and further refine their clinical benefits. This innovative surgical technique is especially considered in cases where neurofibromatosis 2, NF2, or a non-functioning cochlear or auditory nerve is present. But the road to restoring hearing through an ABI involves more than just sound. It's about multimodal integration. Tactile, visual, and vestibular cues combined with auditory input create a richer sensory experience. For instance, hearing assessments conducted at the Nairobi ENT clinic often include vestibular evaluations to understand the full spectrum of a patient's sensory perception. This holistic approach ensures that every aspect of hearing is addressed, from balance to spatial awareness. Combining these modalities can significantly enhance the effectiveness of an ABI and improve overall patient outcomes. This integrated approach not only restores sound, but also enhances spatial orientation and reduces the risk of falls or disorientation. At House of Hearing in Nairobi West, professionals take a similar approach by integrating visual cues during hearing aid fitting sessions. They utilize lip reading techniques alongside the ABI to help patients adapt and gain more from their sensory experience. This demonstrates a forward-thinking methodology in hearing restoration that goes beyond traditional auditory treatments. In essence, multimodal integration is key to unlocking the full potential of an auditory brainstem implant and transforming lives. Understanding this holistic approach helps us appreciate the innovative work being done to restore hearing through advanced surgical techniques. The Da Vinci surgical system, for instance, is a cutting-edge robotic platform that has revolutionized how surgeons perform cochlear implant surgeries. This system consists of multiple arms controlled by the surgeon through a console. The surgical robot's arms are equipped with tiny instruments that can maneuver in tight spaces within the inner ear with unparalleled accuracy. This level of precision is crucial for placing the cochlear implant electrodes precisely where they need to be. Moreover, the robot's high-definition cameras provide a magnified view of the surgical area, allowing Dr. Cadero to navigate the intricate structures of the inner ear with greater clarity than ever before. This advanced technology not only enhances precision, but also significantly reduces the risk of complications during surgery. For patients with profound hearing loss, such as those affected by neurofibromatosis 2, NF2, or a non-functioning cochlear nerve, the accuracy provided by surgical robotics can be life-changing. The continuous evolution of these technologies ensures that more patients can benefit from advanced cochlear implant procedures. This dedication to precision and safety through advanced surgical robotics not only restores hearing, but also offers hope for a better quality of life for patients with severe hearing loss. Genetic testing has emerged as a powerful tool in personalized medicine, allowing for tailored treatments based on an individual's genetic makeup. By understanding the unique genetic profile of each patient, Dr. Cadero can identify specific gene mutations that contribute to hearing loss and develop targeted therapies accordingly. In addition to genetic testing, biomarkers play a crucial role in personalized medicine for hearing loss treatments. Biomarkers are measurable indicators of normal biological processes or disease states that can help in diagnosing and monitoring the progression of hearing loss. By tracking specific biomarkers, Dr. Cadero can determine the most effective course of treatment for each patient's unique condition. Individual patient profiles are meticulously created to ensure that treatments are perfectly aligned with each person's needs. These profiles include medical history, lifestyle factors, and specific hearing loss characteristics. This comprehensive approach allows Dr. Cadero to consider all aspects of a patient's life when developing a treatment plan. Innovative treatment methods such as auditory brainstem implants, ABIs, are at the cutting edge of personalized medicine for hearing loss. ABIs bypass damaged parts of the ear and directly stimulate the auditory nerve, offering hope to patients with profound hearing loss. By leveraging genetic testing, biomarkers, and detailed patient profiles, Dr. Kidero and other experts in the field are revolutionizing the way hearing loss is treated. This personalized medicine approach ensures that each patient receives the most effective and safest treatment possible, offering hope for a better quality of life. Through these innovative methods, the future of hearing loss treatment looks promising. Personalized medicine approaches are leading to better outcomes and improved quality of life for patients with hearing loss. In the quest to restore hearing, innovative bioengineering solutions are being explored for repairing or replacing damaged inner ear structures. This bypass can potentially restore hearing in cases where the inner ear is non-functional due to diseases like neurofibromatosis 2, NF2, or a missing auditory nerve. Researchers are currently exploring the use of bioengineered tissue replacements to regenerate damaged inner ear structures. Stem cell therapies are also being investigated as a means to repair or replace damaged auditory structures. 3D bioprinting technologies are another promising avenue being explored for creating lab-grown inner ear structures. These bioengineering solutions offer promising pathways for future hearing restoration efforts. As advancements in these technologies continue, the potential to significantly improve the lives of individuals with severe hearing loss becomes increasingly feasible. The future of hearing restoration looks promising as these innovative methods are refined and tested in clinical trials. With each new discovery and successful trial, we move closer to a world where hearing loss is no longer a life-altering limitation. For now, the focus remains on continued research and development to ensure these bioengineered solutions can be safely and effectively applied. Meet the experts who are at the forefront of this groundbreaking work dedicated to unlocking the potential of bioengineering in hearing restoration. Gene therapy works by introducing healthy genes into cells to replace or repair mutated ones. The goal is to restore normal function in the inner ear, enabling people with hearing loss to regain their ability to hear. Pharmacological interventions are also being investigated as a non-invasive approach to hearing restoration. These involve the use of drugs that can stimulate or protect inner ear cells. One challenge with pharmacological approaches is ensuring that the drugs reach their target in the inner ear. Novel drug delivery systems are being developed to overcome this hurdle, aiming to deliver the treatment directly to where it's needed. While these advances are exciting, it's important to note that they are still in the early stages of development, and much research is needed before they can be widely implemented. Dr. Kidero and his team are dedicated to unlocking the full potential of these non-invasive techniques, driven by their passion for improving the lives of those with hearing loss. As our understanding of the intricacies of the human auditory system grows, so does our ability to innovate and create more effective, less invasive treatments for hearing restoration. Join us next time as we delve deeper into the fascinating world of auditory science and the cutting-edge research that is transforming lives. One of the cutting-edge techniques Dr. Kidero uses is neuromodulation, a method that enhances synaptic connections in the auditory pathway. Neuromodulation involves stimulating specific areas of the brain to improve neural activity and signal processing. In the context of hearing restoration, it can help patients with severe hearing loss by enhancing their ability to perceive sound. Clinical trials have shown promising results for patients who undergo neuromodulation procedures. For instance, a study published in Auditory found that participants experienced significant improvements in their ability to understand speech and distinguish different sounds. Beyond the laboratory, real-world case studies have also demonstrated the potential benefits of neuromodulation for hearing restoration. One patient with profound hearing loss due to neurofibromatosis 2, NF2, reported a notable improvement in their lip reading ability after receiving an auditory brainstem implant, ABI, which utilizes neuromodulation techniques. As research continues to evolve, Dr. Kidero and other experts in the field are exploring new frontiers that can enhance the effectiveness of current surgical techniques. By understanding how neuromodulation can improve synaptic connections in the auditory pathway, we are moving closer to transforming lives for those with severe hearing loss. Advanced biomaterials are revolutionizing the field of hearing restoration, offering innovative solutions for improving surgical outcomes. These materials are carefully engineered to mimic the properties of natural tissue in the inner ear. For instance, biomaterials used in cochlear implantation support tissue growth and integration with existing structures in the inner ear. This is crucial because it helps reduce inflammation and promotes better healing post-surgery. Some biomaterials are designed to degrade over time, allowing them to be gradually replaced by natural tissue. Others provide long-term support, maintaining the integrity of the implant site for years. The properties of these biomaterials, such as biocompatibility and bioactivity, make them ideal for enhancing surgical techniques. By supporting tissue growth and reducing inflammation, these materials help improve the success rate of cochlear implants. Their pioneering research and surgical techniques are paving the way for better hearing restoration outcomes. As innovations in material science continue to advance, we can expect even more breakthroughs in the field of hearing restoration. This opens up new possibilities for those with severe hearing loss, bringing them closer to a life of better hearing and improved quality. By harnessing the power of materials science, we are moving towards a world where hearing loss is no longer an insurmountable obstacle. Microfluidics is a cutting-edge technology that involves the precise control and manipulation of fluids at the microscale. This innovative approach allows for targeted delivery of therapeutic agents, ensuring that they reach the exact areas where treatment is needed. For instance, Dr. Kidero employs microfluidic devices to administer medications directly into the middle ear, bypassing the outer and inner ear structures. This precise targeting minimizes potential side effects and maximizes therapeutic efficacy. One successful application of microfluidics in hearing restoration is the treatment of otosclerosis, a condition where an abnormal growth of bone prevents structures within the ear from working properly. By using microfluidic devices, Dr. Kidero can deliver therapeutic agents that help dissolve and remove the problematic bone growth, thus restoring normal ear function. Looking ahead, future research is exploring how microfluidics can be used to treat other complex ear conditions, such as inner ear disorders and sensory neural hearing loss. As advancements in materials science continue, the precision and effectiveness of these surgical interventions are expected to improve significantly. Dr. Kidero's pioneering work showcases novel delivery methods that can enhance the precision and effectiveness of surgical interventions, offering hope to countless individuals struggling with hearing loss. This advanced approach not only restores hearing, but also preserves the delicate structures within the ear, ensuring long-term success and quality of life for patients. For those suffering from profound hearing loss, the path to restoration is paved with innovation. Tissue engineering, a cutting-edge field in modern medicine, is revolutionizing how surgeons approach and treat such conditions. Imagine, for a moment, the intricate process of creating patient-specific tissue. This involves taking a small sample of the patient's own cells, culturing them in a lab to grow into the desired type of tissue. This personalized tissue is then shaped and engineered to seamlessly integrate with existing structures within the ear, creating a harmonious blend that promotes natural healing. His work focuses on using tissue engineering to restore hearing while preserving the delicate structures within the ear, ensuring long-term success and quality of life for patients. These customized solutions not only enhance surgical outcomes, but also offer patients a greater chance of living with their natural hearing restored. The journey from hearing loss to restoration is one of personalized care and innovative science, offering a glimpse into the future of healthcare. As research continues and more experts like Dr. Kidero lead the way, we can look forward to even more advanced and effective solutions in hearing restoration. Meet the expert who can restore hearing through advanced surgical techniques and understand their pioneering work. The significance of neurotology lies not just in restoring hearing, but also in maintaining balance, which is integral to a person's quality of life. These advancements can significantly impact daily functioning and well-being. Intraoperative monitoring, ensuring surgical precision, is a vital aspect of advanced hearing restoration surgeries. These techniques allow surgeons to track various physiological parameters in real time, ensuring the safety and success of delicate procedures. For instance, electrocochleography can monitor the integrity of the inner ear during surgery. This technique involves injecting a tracer dye into the cochlear fluids and using an infrared camera to visualize the flow. Additionally, neurophysiological monitoring can assess brainstem auditory evoked potentials, ensuring that crucial neural pathways remain intact throughout the procedure. These methods are particularly important in cases where hearing preservation is a priority. They allow surgeons to make real-time adjustments and avoid damage to critical structures. When it comes to hearing restoration in children, surgeons face a unique set of challenges. Pediatric surgeries require specialized techniques tailored for young patients to ensure the best possible outcomes. The delicate nature of a child's anatomy means that traditional surgical methods may not always be suitable. In many cases, the goal is not just to restore hearing, but to preserve it as well. The auditory system of a child is still developing, and any surgical intervention must account for this ongoing growth. The challenge lies in ensuring that the surgery not only restores hearing, but also supports future development. Innovative surgical methods, such as using advanced imaging technology to map out the inner ear in real time, are being employed to achieve this goal. These advanced methods have led to remarkable success stories. One such case is a young girl named Lila who underwent cochlear implant surgery at the age of 5. Lila was born with profound hearing loss and had received little benefit from traditional hearing aids. However, thanks to Dr. Kadero's expert care and the advanced techniques he employed, Lila can now hear sounds that she could never before. Her parents report that Lila's life has transformed. She is now able to communicate effectively and participate fully in school activities, something that was previously out of reach. Such stories underscore the importance of specialized skills and techniques required to successfully perform hearing restoration surgeries on children. Imagine a world where sound is not carried through the air, but instead travels directly through the bones of your skull. This is the innovative realm of bone conduction implants, a cutting-edge technology that offers hope to those with severe hearing loss. Bone conduction implants bypass the middle and inner ear, transmitting sound vibrations directly to the cochlea via the bones of the skull. This revolutionary approach is ideal for individuals with conductive or mixed hearing loss. Recent advancements in this field have seen significant improvements in electrode design and hearing preservation options. Electrodes, which are crucial components of these implants, have undergone extensive refinement to enhance their efficiency and safety. Connectivity advancements have also been a focus, allowing for seamless integration with various digital devices and improving the overall user experience. The success stories of bone conduction implant patients are nothing short of remarkable. Take, for instance, Maria, a young woman who lost her hearing due to a rare condition. Maria's life transformed after receiving a bone conduction implant. She can now enjoy the symphony of sounds that had once been lost to her. From the rustling leaves in a park to the gentle hum of conversation at a dinner table, these implants have restored a richness to her auditory world that was previously unimaginable. But the journey is not over. Advances continue to be made, promising even more sophisticated solutions in the future. The breadth of technologies available for addressing hearing loss is truly astounding, showcasing the incredible strides being made in the field of audiology. And as we move forward, the future holds immense promise for those seeking to reclaim their connection to the world of sound. The middle ear, nestled between the outer and inner ear, is where the mechanical to neural transformation occurs. It features tiny bones called ossicles, the malleus, incus, and stapes, that work together to amplify sound vibrations. When these delicate bones are damaged or diseased, traditional hearing aids often fall short. This is where middle ear implants come into play. Middle ear implants function by directly stimulating the ossicles with a tiny vibrating device. This method bypasses the damaged portions of the middle ear and delivers sound vibrations directly to where they are needed. This innovative approach offers several advantages over traditional hearing aids. It provides more natural sound quality and better speech discrimination in noisy environments. Moreover, middle ear implants are less likely to cause the occlusion effect, where your own voice sounds unnaturally loud in your ears. His patients report a dramatic improvement in their ability to hear and engage with the world around them, reclaiming a vital connection that had been lost. Perhaps most notably, Dr. Cordero has developed a less invasive technique for middle ear implants, particularly effective for those with certain types of hearing loss. This innovative approach minimizes recovery time and reduces the risk of complications, offering patients a safer and more efficient path to restored hearing. As we continue our journey into the future of hearing restoration, it's clear that middle ear implants are revolutionizing the field. With each advancement and every success story, we move one step closer to a world where hearing loss is no longer an insurmountable barrier. Imagine a future where hearing loss is no longer an insurmountable barrier. Advances in stem cell therapy are bringing us closer to this reality, offering hope and potential solutions for those affected by significant hearing loss. Stem cell therapy holds immense promise for treating conditions previously considered untreatable. Unlike traditional treatments that focus on managing symptoms, stem cell therapy aims to regenerate damaged tissue and restore function. Recent research findings have shown promising results in animal models, suggesting that stem cell therapy could be a viable option for humans with severe hearing impairment. However, more clinical trials are needed to validate these initial discoveries. So, hold on to that hope and keep exploring the exciting possibilities that stem cell therapy brings to the table. After all, every small step forward could lead us to a major breakthrough in hearing restoration. For decades, the search for a cure to hearing loss has been unrelenting. But what if we could go beyond treatment and actually regenerate lost hearing? Enter the world of regenerative medicine, where scientists are exploring innovative approaches to restore auditory function. One promising avenue is stem cell therapy. Stem cells, often referred to as master cells, have the unique ability to transform into various types of cells in the body. In hearing restoration, scientists are experimenting with ways to harness these cells to regrow damaged inner ear tissues. Imagine tiny stem cells injected into the inner ear, where they could potentially differentiate into healthy hair cells or neurons, repairing the damaged structures that are essential for sound transmission. But stem cell therapy is not the only groundbreaking approach in regenerative medicine. Gene editing techniques like CRISPR are also showing great promise. CRISPR allows scientists to make precise changes to DNA, targeting and correcting genetic mutations that cause hearing loss. This technology could potentially cure hereditary forms of deafness by altering the very blueprint of our cells. Moreover, researchers are exploring bioengineered tissue for inner ear repair. By creating artificial inner ear structures in the lab, they hope to provide a scaffold for natural tissue growth and restoration. These innovative approaches are not just theoretical. Clinical trials are underway, testing the safety and efficacy of these cutting-edge therapies in real patients. Every successful trial brings us one step closer to a true cure for hearing loss. While the road is long and challenging, the potential rewards are immense. Imagine a world where deafness is no longer a lifelong condition, but a treatable and even reversible medical issue. And behind every breakthrough, there are pioneering scientists tirelessly working to make this vision a reality. Their dedication and ingenuity are what drive us forward in the quest for hearing restoration. Advanced materials, such as those used in the latest electrodes, offer enhanced durability and biocompatibility. This means that the devices can better withstand the intricate environment of the inner ear without causing irritation or rejection. New electrode designs are also revolutionizing cochlear implant technology. These innovations often incorporate more contacts, which allow for greater stimulation precision and improved sound quality. Scientists at the Cleveland Clinic have noted that these advancements in electrode design can significantly enhance the sensation of sound for individuals with profound hearing loss. This is particularly important for those who rely on lip reading due to conditions like neurofibromatosis, 2, or a non-functioning auditory nerve. These technological advancements are not just about the hardware. They also involve sophisticated software that enhances the processing of sound signals. This combination of cutting-edge materials, innovative designs, and advanced algorithms is what makes modern cochlear implants so effective. As we delve deeper into these innovations, it's clear that the goal is not just to restore hearing, but to do so in a way that preserves natural sound quality. This is where the true ingenuity lies, in creating devices that mimic the intricate processes of human hearing. As we continue to explore these technological breakthroughs, we find ourselves on the cusp of a future where hearing loss is no longer a barrier. With each advancement, we move closer to realizing the dream of fully restoring the sense of sound. And this brings us to a crucial point. The pioneering work of scientists like Dr. Cordero is not just about creating better devices, it's about transforming lives. Each electrode innovation, each design refinement, is a step forward in our quest for hearing restoration. As we conclude this journey through the advancements in cochlear implant technology, we are left with a sense of awe and gratitude for the dedication and ingenuity that drive these innovations forward. And so, as we look towards the future of hearing restoration, let us remember that each breakthrough is a testament to human resilience and our unyielding pursuit of a better world for those who need it most. You might be surprised to learn that spine health can significantly impact your hearing. Misalignments or issues in the spine can affect the nervous system, including the auditory pathways. Did you know that the delicate balance of spinal fluid plays a critical role in maintaining inner ear function? This is especially relevant when considering surgical procedures aimed at restoring hearing loss. Cerebrospinal fluid, or CSF, surrounds and protects the brain and spinal cord. It acts as a cushion, providing support and shock absorption to these vital structures. Changes in CSF pressure can impact the inner ear's cochlear fluid, which is crucial for maintaining hearing health. High or low CSF pressures can lead to changes in cochlear function. In fact, studies have shown that abnormal CSF flow patterns are associated with various types of hearing loss, including sensorineural and conductive hearing disorders. Recent research has uncovered a significant correlation between CSF dynamics and the prevalence of Meniere's disease, which is characterized by episodes of vertigo accompanied by fluctuating hearing loss. Understanding this link between spinal fluid and inner ear health is crucial for developing targeted interventions to mitigate these effects during hearing restoration surgeries. By monitoring and managing CSF pressure levels preoperatively, surgeons can optimize surgical outcomes and reduce the risk of post-operative complications. Moreover, advancements in cochlear implant technology have integrated features that account for fluctuations in CSF pressure, ensuring more stable and effective hearing restoration. This holistic approach to hearing restoration not only addresses the auditory system, but also considers the broader health of neurological pathways that can impact overall hearing function. Incorporating these insights into surgical practices allows experts like Dr. Evans Cordero to provide more comprehensive care for patients undergoing complex hearing restoration procedures. Ultimately, this understanding of the interconnected nature of our body systems underscores the importance of a multidisciplinary approach to healthcare, where specialists collaborate to achieve the best possible outcomes for their patients. The intricate web of interconnected body systems reminds us that even subtle shifts can ripple through our physiology. One such relationship, little explored but significant, is the link between spinal fluid pressure and hearing loss. Spinal fluid pressure, often overlooked in audiological contexts, plays a pivotal role in maintaining the delicate balance within our cochlear system. Studies have shown that elevated intracranial hypertension, a condition characterized by increased cerebrospinal fluid (CSF) pressure, can adversely affect auditory function. This pressure, when unchecked, can compress the delicate structures within the cochlea, hindering their ability to transmit sound waves effectively. Further investigations have revealed that CSF dynamics are not merely passive, but actively regulate the inner ear environment, influencing cochlear function and perception. His research underscores that even slight variations in CSF levels can precipitate noticeable changes in hearing acuity, emphasizing the need for a holistic approach to patient care. Understanding this intricate relationship opens avenues for innovative therapies that address both spinal fluid management and auditory rehabilitation. In conclusion, the journey from spinal fluid pressure to hearing loss is a fascinating exploration of how our bodies are intricately woven together. Cerebrospinal fluid, or CSF, plays a crucial role in our body's delicate balance system. It bathes the brain and spinal cord, providing cushioning and nourishment. But did you know that changes in CSF pressure can also affect inner ear function? For instance, increased intracranial pressure, often due to conditions like hydrocephalus or a brain tumor, can cause hearing loss and tinnitus. This is because the inner ear relies on precise fluid dynamics to translate sound waves into electrical signals that the brain can understand. One of the most intriguing conditions related to CSF pressure is Meniere's disease. This inner ear disorder is characterized by episodes of vertigo, tinnitus, and a sensation of fullness in the ear. Researchers have found that abnormal CSF pressure may contribute to the development of Meniere's disease by disrupting the delicate balance of fluids in the inner ear. Recent studies have also shown that CSF protects the cochlea, a crucial part of the inner ear, from damage. It acts as a buffer against excessive sound exposure and other stresses. Understanding these connections between spinal fluid dynamics and hearing loss is essential for developing advanced surgical techniques to restore hearing. By managing CSF pressure and protecting the inner ear, experts can help patients regain their sense of sound. And with each advancement in understanding this intricate relationship, we move one step closer to unlocking new possibilities for hearing restoration. This deeper knowledge provides a foundation for innovative treatments that can transform the lives of those experiencing hearing loss.